Hi, this is Kayannush here. I'm a dental surgeon practicing in Bombay, South Bombay, Malabar since 2012 now. Uh, so in our clinic we do all sort of work. We provide dental care for the entire family. Today we're going to talk about how to maintain oral hygiene at home in these times. So the first and most important thing for you to do is brushing, which I'm sure everyone knows. You're supposed to brush twice a day, and brushing at night is really more important than brushing in the morning. Brushing in the morning is usually only for freshness, but brushing at night is important because that is the time you want to remove whatever you've eaten throughout the day. Because if you sleep without brushing, then the food that is stuck on your teeth, the bacteria acts on that food and causes decay. So brushing at night is really imperative. I would also like that we add flossing to our oral hygiene. Flossing can be done once a day. It has been advised to do flossing since the 1800s, and many people feel scared to do flossing because of bleeding, but if done properly, it is a really good tool. Do not underestimate mouthwashes because mouthwash helps in giving you freshness. It removes whatever stuck between your teeth and it reduces the pH of the mouth as well. So mouthwash is also a very good thing. And you're supposed to drink a lot of water. Now, talking about brushing, you can use your manual toothbrush or you can use a motorized electric toothbrush. So a motorized electric toothbrush is supposed to give you around 20% better at removing tartar than your manual toothbrush. It is much better for kids, for people who have braces, for people whose dexterity is a little less, old people who have arthritis. So these powered toothbrushes are really helpful for them. Nowadays they come with a lot of features. They come with gum massaging, they come with timers that helps you time your toothbrushing. If you are using an electric toothbrush, then 2 minutes is enough to brush your teeth. Whereas if you're using a normal manual toothbrush, then you're supposed to brush for about 4.5 minutes each time. So like 4.5 in the morning, 4.5 in the evening. You're supposed to change your toothbrush every 7 weeks. That is less than 2 months time. Or every time that you recover from an illness as well. So whenever you've fallen sick, it's better that you change your toothbrush after you've recovered from that. If not 7 weeks, at least after 3 to 4 months is the good thing to do to change a toothbrush. And in the motorized toothbrushes also, the newer ones come with a detachable head, so you can change that also after whenever you see spraying of those bristles, that is a good time to change a toothbrush. Now coming to flossing, there is the traditional threaded floss, which was there since the 1800s. For better usage, nowadays companies come with floss on a stick. So it's attached in the form of a C that goes, it's easier for people to floss their teeth. And there is also something called as water flossing or water irrigation, which is basically pulsating water that helps in going between your teeth. That helps in keeping your interdental area clean. Water flossing is very important for people who have implants, people who have bridges, people who have braces, where your normal toothbrush is difficult to go to. Regarding mouthwash, there are different types of mouthwashes available in the market. You could use any, and Mouthwashes that have chlorhexidine is usually used for people who have gum diseases, and mouthwashes that have a fluoride content in it are used for people who are undergoing orthodontic treatment. And a regular mouthwash is good for everyone. Another good tool is actually chewing gum. Chewing gum which is without sugar-free chewing gums are good because they stimulate salivary flow. They help in removing food that is stuck on your teeth. It helps in stimulating the muscles, and it gives you a freshness in your mouth as well. So chewing gum is also a good thing. Another thing that we could keep in mind is to avoid eating sugary things at night, especially. So sweets, chocolates, food that has a lot of carbohydrate, processed food, these are a little no-no. You could munch more on crunchy foods, fibrous foods, which help in keeping the mouth clean. And you should drink a lot of water. It helps in reducing the pH of the saliva. It also helps in keeping the mouth clean. So this is a brief on oral hygiene that we could do at home right now. I'll be really happy to answer questions that you all will have. Okay, one of the questions I've got is how to reduce bad breath by Vijay. So Vijay, to reduce bad breath, you need to, so bad breath is caused because of accumulation of plaque and tartar in the mouth. So you need to make sure that that does not happen. So you have to brush twice a day for that. You have to floss between your teeth so that anything that is stuck out there and that decays over a period of time, that does not cause bad breath. You also have to clean your soft tissues, that is your tongue and your cheek from the inside. There are tongue cleaners available in the market, or you could use the back end of your toothbrush, the part behind where the bristles are. So usually they have a little rough surface, a corrugated surface, so you could use that to clean not only your tongue but the insides of your cheek as well. Use mouthwash to keep yourself fresh, and chewing gum. So that increases your salivary flow, and that causes circulation changing of the saliva, and that reduces bad breath. Another question that was asked by Pranav is how safe it is to use a toothpick. So toothpicks are not really the best option. It's not safe because it causes more harm than good. You could be pushing the food particle more into the gum than getting it out easily. If you can get it off easily, that means there is a big gap between your teeth, and then you should rather use interdental brushes than toothpicks. If food is continuously getting stuck between your teeth, then the right thing to do is to floss your teeth. So you take your floss and you take about 8 inches of your floss and roll it between your middle fingers and twine it till it's very close, and then you push it between your teeth in a seesaw motion, in a sawing motion, sorry. And once it is between your teeth, you pull it towards the tooth in front and do an up-down motion. Take it to the tooth behind and do an up-down motion. If you go too deep with your floss, then you tend to hurt the gingiva, and that is what hurt the gums, and that is what causes bleeding. So this, if the gums are healthy, then usually bleeding does not happen. Let me see for any more questions. Okay, there is another question that has come, that is tips for oral care for children by Aman. So Aman, for children, how old is the child actually. So for very young children, it is for babies actually it is better that the mom cleans the teeth, mom or dad, a guardian. So you put gauze on your fingers and then you could clean your gums with that. For routine for children that are less than 5 years of age, you could use the toothbrushes that are there for children. They are smaller in size and use a non-fluoridated toothpaste then, because you do not want the child to ingest fluoride then. And you encourage the child to brush their teeth, and usually after the child brushes the teeth, I would advise that the mother also brushes the tooth, so that in case there are places where the child has not reached comfortably, it is that the mother cleans all those areas as well. And then once the child starts growing up, he learns to brush better with himself. You just need to monitor and to stimulate the children to brush their teeth, because their products come with cartoon characters on the brushes, well, the kid brushes, so that encourages children to brush. Also, electric brushes are very good for children because they find it more fun, and they usually do not like to brush for 4.5 minutes. So the electric brush, when you can clean for about 2 minutes, because it automatically also swivels, it rotates and it vibrates. So even if the child is not brushing well, the electric toothbrush is taking care of it as well. Let me see more questions. Ahmad has asked whether electric or manual toothbrush for daily oral care. So honestly, both toothbrushes work well. If you are used to a manual, you can use manual. If you're used to an electric, you can use electric. Electric though has an advantage. Along with you brushing your teeth, the brush also has a circulatory, rotatory motion or a vibratory motion, or some brushes have both actually. So along with you cleaning, it also enhances the cleaning. Electric toothbrushes in some studies show that it removes 20% more tartar, plaque and tartar in a person's mouth, and it causes 10% less gum diseases. But that does not mean that your normal manual toothbrush will not, if you can brush well with that. Electric toothbrush is good for, as I mentioned earlier, for children, for old people, for people who have difficulty in dexterity. Out there, the electric toothbrush will help. So the only thing is with the electric toothbrush, it gets a little messy because there's a lot of saliva that keeps swirling in your own mouth. You get used to it. Electrical toothbrushes are actually, in my opinion, I find them much better. And the other question is, are hard bristle brushes better for cleaning teeth? But Atulya, no, 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 no. It's a good question actually. I should have mentioned this earlier. You should use only toothbrushes that have soft bristles, not hard bristles are definitely no-no. Worst case scenario, you might even consider a medium bristle toothbrush. People have that feeling that until I do not brush and brush hard with a hard bristle toothbrush, I do not feel clean. It's a misconception, it's a complete misconception. Because a hard bristle toothbrush is going to cause more harm than good. There is something called as abrasion, where if you brush a lot hard, I mean if you brush like more than twice a day, and if you brush with a hard bristle toothbrush, and if you brush vigorously and you brush in a to and fro motion, it causes more damage than good to the teeth. It causes wear of the enamel near the necks of the teeth, and that is really not a good thing. I would always suggest to go in for a soft bristle toothbrush, and people who have gum problems, there are super soft bristle toothbrushes as well. So people who have had an oral surgery, an extraction, or have gum problems, then a super soft bristle toothbrush will help them. Otherwise, for general use, a soft bristle toothbrush is good. Another question is, Can we use an electronic brush after filling in the tooth? By Raghavendra. Yes, Raghavendra. Actually, it depends upon what filling has been done by the doctor. So, in case there is a temporary filling, a provisional filling, then it's not advisable because the temporary filling is engineered to come out easily and the doctor would have done it between two appointments. But if it is a permanent filling, then yes, an electrical toothbrush will cause no harm to the filling. So that is there. A question by Swati is how to take oral care of a 4-year-old child. Uh, so a 4-year-old child has just got her milk teeth in. It is important that you use toothpaste and that are mentioned that for less than 5 years of age. They are non-fluoridated toothpaste actually, and you use the small kids toothbrush. You encourage the child to brush the teeth, and after the child has brushed the teeth, I would suggest that you also brush the teeth of the child to make sure that the child has cleaned every surface, because at the age of 4 the child has all milk teeth which are more prone to a cavity formation. So and once a milk tooth gets a cavity, it rots all the teeth, and these teeth are going to stay in your mouth till the age of 14, 15. So it is important that you really take care of your milk teeth as well. So you encourage the child to brush, and after the child brushes, I would suggest that you also have a look at it, supervise it, and then maybe clean the areas where it was difficult for the child to brush. The next question would be, what is the solution for dry mouth? By Chandra. So there are many reasons that cause dry mouth. Primarily is as we start aging, we take a lot of medicines, and those medicines tend to reduce the salivary flow. So that causes dry mouth. And another common reason is people who are taking anti-cancer treatments. So they also have a lot of dry mouth problems. In case you have tremendous dry mouth, I would suggest that it is important that you sip on water continuously, because dry mouth, the saliva actually helps in remineralizing the teeth and cleaning the teeth. And if you have a dry mouth continuously, you have more chances of having decay. So you keep sipping on small amounts of water. Another thing is you could suck on sweet or sour sweets, candies, because they tend to stimulate your salivary flow. So suckling on a sweet or a candy might help you. And in case the problem persists, and then it's better that you get it shown to a dentist, to your routine dentist. Let me see, the next question is how to reduce yellowness of teeth, by Nitin. So Nitin, there are two things. Your inherited tooth color usually in the Indian population is yellowish whitish. That is going to remain. So by brushing hard, it's not going to remove the yellowness. So never brush really hard intending to remove the yellowness. If you wear off your enamel and start exposing the layers within, it will make your teeth appear more yellowish. You use your normal toothbrush and a normal toothpaste, and it is important that you get a cleanup done by a dentist. So when you come to a dentist, there are two options that they can do. One is a routine cleanup, which will remove any plaque and tartar and stains that are there on top of your tooth. So, but the inherited color of your tooth is going to remain the way it is. But anything that is coating your tooth will come out. And there are other treatment options like tooth whitening, where they use chemicals, and that will start dropping your shade, and that will cause tooth whitening for you. Another important thing is that if you are having any aerated drinks like Coca-Cola or any of these aerated drinks in the night, it is important that you do not brush your teeth for an hour after you have them. because these aerated drinks have a lot of acidic content in them. So it makes your teeth soft. And then if you brush hard with it, you will erode your enamel. So it is important that you wait for about 1 hour after you have these aerated drinks and give your saliva some time to remineralize the tooth back, and then you can start brushing your teeth. You can use your mouthwash in the meanwhile. Is brushing recommended every time I consume food, sweet, soda, or 2 times a day is enough? By Atulya. Atulya, actually, this is what I was talking right now. Twice a day is good, I mean, brushing more than twice a day is not, I mean, if you brush wrong, if you brush hard, then you're doing more harm if you brush more than twice a day. So brushing twice a day is really good. After you eat any food or you eat anything sweet, it is important that you rinse your mouth. I mean, I understand. I mean, if in an ideal world, I'm supposed to advise everyone not to eat any sweets, any chocolates, but everyone does have a sweet tooth. So you eat your chocolates, you eat your sweets, but then immediately after you eat something like that, it is important that you gargle, you rinse your mouth, and when you rinse, I mean, you swirl the whatever you've taken in your mouthwash or your glass of water, you swirl it in your mouth like forcefully. You make sure that it is going between your teeth, it is coming out so that everything that is stuck around your teeth comes out. So even after you snack something sweet in the afternoon, I would suggest that a gargle would be good enough. And then in the night, obviously, you're supposed to brush your teeth. After sodas, as I mentioned earlier, it is not advisable to brush till 1 hour passes after you have had your last soda, because as mentioned earlier, it causes your teeth to weaken out. Okay. And the next question is, how often should we visit a dentist? This is a really, really good question. So, ideally, you're supposed to visit dentist. Theoretically, you're supposed to visit a dentist twice every year, once every 6 months, which actually, honestly, nobody does. I tell my patients that at least visit your dentist once a year for a professional cleanup, because no matter how good your oral hygiene is, no matter whether you are brushing and flossing your teeth, there is always going to be some areas where your toothbrush is not going to reach. There are places where you will not be able to keep the area clean. So once every 6 months, or that's the good thing to do, or at least once a year, you should come to your dentist, where he will clean that area up for you. He will do a thorough cleanup. And the advantage is that every time that you visit the dentist, he gets to check all your teeth. So in case there is a cavity that is forming, he can correct it at that step itself. So dentistry is actually not expensive. Procrastination is. I mean, the more that you keep postponing going to a dentist, and the more that you do not come to a dentist, what could be corrected as a cavity may result into a root canal. So which is obviously much more expensive. So what I mean to say is that if you go to your dentist regularly, if you go at least once a year, if not once every 6 months, it is good for you. He can catch anything that is not only on your teeth, he checks your gums, he checks your soft tissues, if there is any ulcer that needs any attention, if there is any lump, if there is any swelling, which you might not even notice, he probably would. So it is important that you visit your dentist at least once a year. What I usually tell my patients is that you tend to remember a few days, like, your birthday, your anniversary. So keep your annual dental checkup about a week before your birthday or a week before your anniversary or something like that. So it mentally helps you to remember to go to your dentist then. Once you form it into a habit, it will be good. And what better to have clean pearly teeth on your birthday? Let me see the next question. Um, Cause of bleeding gums and how can we take care of our gums, by Ahmad. Emma, bleeding gums is a sign of gum disease. Uh, so first thing when you have bleeding gums is you have to go to your dentist. He needs to do a professional cleanup for you that will remove whatever is your problems. Because of bleeding, so when you do not get a regular cleanup done, or if there is something lacking in your oral hygiene, your so a plaque forms on the layer of your teeth, and over a period of time, the plaque turns to tartar. Tartar is basically calcified plaque. As this tartar keeps growing, it starts harming the gums around. And when the gum around starts getting inflamed, the first reaction of an inflamed gum is to bleed. So that is what causes bleeding gums. What you could do is you start massaging your gums at home. You use salt water and lukewarm water, and you gargle with that. So whatever infection is there, it tends to reduce it, and you definitely need to visit your dentist. Once he does a professional cleanup, he removes whatever tartar is there, and then that would help you. So that is bleeding gums. A question following is, what is the required amount of pressure to be used while brushing? Many a times I feel little pain after I have completed brushing by Ahmad again. Uh, so you're not supposed to apply a lot of pressure, Ahmad. And more, it's supposed to be in gentle strokes. You're supposed to do it in a circular motion, and if you brush in a vibratory motion and to and fro motion, and you're continuously brushing near your gums, that will cause your bleeding, that will cause pain on brushing. So you're supposed to do a um, gentle brushing motion in a circular motion. You put your toothbrush at an angle of 45 degrees going into the gums, and then you do a swishing motion upwards as well. So if anything that is stuck between your teeth, that is stuck at the level of your gums, all of it can come out. You brush the top surface of your teeth, the front surface of your teeth, the back surface of your teeth. You have to basically, it is an important thing that you clean all the surfaces of your teeth as well. So that is electrical toothbrushes have sensors. So the more sophisticated ones, like the Oral B Pro 2000, actually, it has a sensor. It has gears in it. So in case you apply more pressure, then the toothbrush will stop. It will not rotate anymore. And it has a red light also that warns you that you are applying much more pressure than what you're supposed to. So probably that might help you. What is the what should be done for sensitivity by Kavita? So Kavita, again, there are many reasons of sensitivity. One of the reasons of sensitivity is that your enamel is wearing off. Again, the reason that the enamel is wearing off is you're brushing too hard, probably in your case, you're brushing too hard. So the enamel is thinnest at the necks of the teeth. The neck of the tooth is the area where the tooth meets the gum. So out there, the enamel layer is actually very thin, and if you brush hard in the to and fro motion, that is the area of your enamel that gets more worn out. So once you lose the enamel layer, what happens is then the underlying dentine gets exposed, which causes sensitivity. You could start by using anti-sensitive toothpaste. There are many anti-sensitive toothpaste available in the market. What I recommend is you apply the toothpaste on the tooth that is sensitive as an ointment, leave it out there for about 5 minutes, and then brush your teeth. So that could help you. In case this is not helping you, you would require probably a filling, or in a more severe circumstance, you would require a root canal for that particular tooth. Again, it is advised that you go to your dentist. He will check you out and he will tell you what is the best treatment option that is there for you. Okay? How to reduce yellowish teeth behind the teeth by Devasis. Uh, Again, Devasis, I mentioned earlier that yellowness is usually the color of the teeth in the Indian population. Indian teeth are usually whitish to yellowish. They range in that. So if there is, if you are, obviously if you're a tobacco eater and there are lots of stains on it, then you need to go to a dentist where he will clean the teeth for you. Do not brush vigorously. That is not going to remove your stains up to after a certain point. How much ever you brush, it's not going to come out. They come out by special instruments that the doctor uses in the clinic. So you need to visit the dentist. He will do an oral prophylaxis or a tooth cleaning procedure where he removes the plaque, the tartar, and the stains that is stuck on top of your teeth, and that will show the inherent color of your teeth. Okay. Beyond that, if you want to correct the yellowness of your teeth, then you have to undergo a tooth whitening procedure where the doctor uses certain chemicals to clean the top surface of the tooth. Okay, right now, the next question is, right now the kids are indoors, so the intake of sugar is slightly higher than usual. So what precautions as parents should we take by Darius? Um, Actually, Darius, if the kids are indoors and the sugar content should be less because you are monitoring what the child is having. But if the sugar content is more, then you make sure that the child at least rinses his mouth after every time that he eats a chocolate or candy or whatever it is. Avoid sticky candies which have a lot of caramel in it. So like those sugary sweets that we used to have as kids, or chocolates like Five Star, Mars, which have a lot of caramel in it. They tend to stick on your teeth. So avoid eating those chocolates, and after you eat them, it is advisable that you rinse you gargle and you rinse your mouth so that the sugar content is not stuck to your tooth. Also avoid eating more refined foods. It's better to start incorporating fruits and fibrous fruits and foods in your diet, so that has a cleansing effect also. You could use non-sugar chewing gums for the kids also, so that it removes anything that is stuck on the teeth. Doctor, is it safe to visit a dentist in the current situation? By Sandeep. So something, this really depends on what is the urgency of your treatment. I mean, if there is something that does not require an urgent or emergency care, I would advise not to venture. And it depends on the dentist that you go to. So, in this current situation, what are the precautions that the dentist is taking, not only to protect himself but to prevent any cross contamination between patients? You have to make sure that the dentist has these checks in place, and in case there is an emergency, obviously you need to go to a dentist. So it is the dentist is also going to ask you a coronavirus history. So you need to be honest, like, that if you have been tested, or it's not only for the safety of you or and the dentist, it is also for the safety of all the other patients that are going to visit the dental clinic. So keeping all this in mind, it is really your call on how safe it is and whether you should venture out or not. Okay, another tip I wanted to share with y'all is that, as I mentioned earlier, that you should brush for at least 4.5 minutes. For kids, Swati was asking, another good thing to do is, what I advise my patients is to play your favorite song. So usually songs are for 3.5, 4 minutes. So till the song goes on, you keep sure that you or your child is brushing the teeth. That's a good way to have to stimulate your biological clock, but you know that you're brushing for at least 4 minutes. So play a song in the background, whichever is your favorite song, whatever it could be. So till the song goes on, you brush your teeth. So you make sure that you brush on your left, and you make sure that you brush on your right. You make sure that you brush your upper teeth, your lower teeth, on the top surface, the cheek surface, the surfaces, the tongue surfaces as well. That is another important clue. A question by Aman is, can I follow any specific diet to keep my teeth and gums healthy? So Aman, for a diet to keep your teeth healthy is obviously you should avoid eating a lot of carbohydrates, you should avoid eating a lot of sugar, you should avoid eating lots of chocolates. You should add a lot of fibrous foods. You should add a lot of fruits to your diet. You should, because fructose is different than glucose. It's a more difficult carbohydrate for the bacteria to break. So fibrous foods will also keep your teeth clean. It will remove anything that is stuck in the nooks and crannies of your between your teeth. So fibrous foods, fruits, avoid carbohydrates and sugary foods, and drink lots and lots of water. It is very important that you drink a lot of water. Drinking a lot of water will stimulate salivary flow in your mouth, and that will also help to keep the teeth clean. It also reduces the pH that is building up in your mouth. So after you've eaten something, if you feel that your teeth are a little bit, if you feel that it is getting a little bit more acidic, water content will tend to wash off whatever is there in your mouth as well and reduce the pH. The question following that is, Doctor, during COVID, we have been told to drink hot water every time. Does hot water affect tooth anyway if we take it continuously? By Dr. Diksha. Uh, Diksha, no, really, not really. Actually, hot water is not going to cause any problem to your teeth specifically. Do not drink, obviously, scalding hot water because you do not want your gums to get burnt or have ulcers to them. But routinely, lukewarm water that we usually drink will not cause any harm to your teeth. Actually, so sometimes there are certain dental problems which if your tooth is hurting while drinking hot water, then you need to visit the dentist because sometimes the tooth tends to hurt. That is a sign of a dental issue. So Kavita is asking how to maintain oral care during lockdown. So yeah, Kavita, oral care, as I mentioned earlier, you need to brush your teeth. You need to brush your teeth twice a day. Once morning is for freshness, honestly, and the second time in the evening is basically to remove whatever that is there in your mouth after you had your dinner and after you had your food and meals or whatever. So brushing your teeth twice a day, flossing at least once a day. So you floss either with a threaded floss or with flosses that come with a handle on it or water irrigation. So flossing is also beneficial for whatever is stuck between your teeth. Then third thing is you should incorporate mouthwash because mouthwash will change the pH, improve the pH of the mouth. It will help in remineralizing the teeth and it also helps in removing whatever is stuck between your teeth. So yeah, toothbrush, flossing, mouthwash. Massage your gums. Massaging your gums is also very important. So that is another thing that you should do. What precautions should I take if I need to visit a dentist now? What precautions you need to take if you visit a dentist now? It's a good question actually. So if possible, you should get your COVID testing done to make sure that you are negative. So that is one. Two, when you go to a dentist, after you leave your home, do not venture to many places. Just go directly to your dentist so that your chance of exposure is less. You're not coming in contact with unnecessarily. You're not coming in contact with many people. So wear new clothes, as in freshly washed clothes, preferably clothes that are dried in the sun, so that there is no virus that's stuck to them. Go directly to your dentist, get your COVID testing done, then usually go alone to the dentist. Do not go with many people so that other people are not unnecessarily exposed. And when the dentist gives you the form, just feed everything in honestly. Um, the dentist will obviously give you hand sanitizer, so clean your hands properly. Wear a mask continuously so that there is less exposure. So these are the precautions that you should take. Doctor, do I really need to floss daily? By Gotham? Gotham, yeah, you are supposed to floss daily. Um, so there are different, I mean, flossing has been advised since it was first advised in 1819. So it's basically more than 200 years that it has been advised, but yet people are not doing. Uh, so the main reason that people are really scared of flossing the teeth is bleeding actually. But if you floss too hard, then you get bleeding, and if you do it correctly, you should not get bleeding. In case you're getting bleeding, slight bleeding, that is because your gums are inflamed, and that will go if you floss continuously. So the more you floss, the more you remove food that is stuck between your teeth, the more the less food that is there, the less the gums will be inflamed. So yes, it is important that you floss your teeth. It's difficult for people to start flossing, but once you get into the habit, it is possible. So for you to floss, basically you take about 8 inches of floss, you wrap it around your middle fingers, and then you hold it with, and you come as close as possible, and then you hold with your thumb and your index finger, and then you put it between your teeth. 8 inches of floss is enough to floss all your teeth between upper and lower all the teeth. If you feel that flossing with this threaded floss is difficult, then you can try the flosses that come on a stick. So there is a small little floss thread that is stuck to a C-shaped stick. So you use the stick and you just push that floss between your teeth. So that is also easy. If all of this is not possible, then you could possibly go in for water irrigation. So there are multiple water flossers, as they call it, available in the market, where it gives water in a pulsating form, in a slight pressure, pulsating pressure. You use that, you put it between your teeth, and you put it near the gums of your teeth, so whatever is stuck comes out. The reason you are supposed to floss, Gotham, is that your toothbrush is not going to remove anything that is stuck between your teeth. Okay, the toothbrush is going to remove everything that is stuck on top of your tooth and on the sides of your tooth. But certain food like leafy vegetables, like meat, they tend to get stuck between your teeth. So only thing that is going to go between your teeth is going to be is a floss. So you really do need to floss between your teeth. In case there is a wide gap between your teeth, then an interdental brush will also help. An interdental brush is a small tufted brush which goes between your teeth. But if your teeth are healthy and they are in a proper tight contact, then the interdental brush will not help you. Then only a floss will help you. So regarding a floss, that is you do need to floss at least once a day. How often should one change the toothbrush? By Darius again. Uh, the textbooks tell you that you are supposed to change your brush once every 7 weeks. That is less than 2 months. Sure. Practically speaking, at least once every 3 to 4 months is a good time for you to change your toothbrush. To check is when you start seeing that the bristles are no longer straight, they start splaying, they get twisted. That's when it is not going to help you. It's going to start causing more harm. There are certain toothbrushes that changes color over a period of time that indicates that yes, it is time for you to change your toothbrush now. Another important thing is that if you have fallen sick and you've recovered from your illness, you should change your toothbrush after that as well. Because many a times there are many illnesses that come out from your saliva, that come out from your mouth. You feel it when you are sick. So those bacteria and everything that is there, it's better that you just chuck your toothbrush out. So your normal manual toothbrush is supposed to change every 7 weeks, if not 3 to 4 months. And even your motorized toothbrushes, most of them come with a detachable head. The bristle heads are detachable, so you are supposed to change those also. They are available freely online and or to wherever you purchased your electrical toothbrush from. It is important that you change your toothbrush once every 3 to 4 months at least, if not 7 weeks. Textbooks say 7 weeks. And after you recover from an illness. Rajesh, I just answered the question. I believe you asked the same question. How often is one supposed to change the toothbrush? Rajesh, I was just talking about it. You're supposed to change the toothbrush once every 7 weeks. According to the textbook, practically once at least once 3 to 4 months. And after you recover from your illness, any illness. A doctor do Sorry. Doctor, am I grinding my teeth while eating some hard food? If yes, then what precautions should be taken? By Rajesh. Am I grinding my teeth while eating some hard food? If yes, what precautions should be taken? So your teeth are designed to eat whatever hard food that we are cooking. I mean, obviously, I presume you're not chewing on bones and you're not chewing into nuts like you're trying to break a groundnut or a walnut or something like that. So, so your routine foods you can eat normally, but do not try munching into bones or something. They are not designed. Our teeth are not designed to eat something so hard. And if you feel that you are grinding your teeth more than normal, it is better that you show it to your dentist. He will check for any wear facets that are present. In case there are, he will tell you what to do. Doctor, does chewing gum help in maintaining oral hygiene? By Kunal? Yes, chewing gum, sugar-free chewing gums do help in maintaining oral hygiene. Yes, I believe so. One, it stimulates salivary flow. Two, it removes any food particle that is stuck between your teeth or not necessarily between your teeth, anything that is stuck on your teeth, it can remove that. Three, it causes freshness. Four, it stimulates your jaw muscles. So yes, chewing gum is actually good, but then chew the ones that are without sugar, sugar-free chewing gums. The last question that we have right now is what should I do for toothache? What should I do for toothache? You're supposed to visit your dentist for toothache. Uh, but so there are many reasons that you could be having a toothache, or you could probably start off by taking a painkiller right now and booking an appointment with your dentist. Um, so see what causes you relief. Stick with a mild painkiller and visit a dentist if you have a toothache for sure. Anyways, I think we've really run out of time right now. I would like to thank the Oral-B team for having me here. And if there are any more questions, we would definitely, you could post them, we would reply to them later. It was wonderful talking to all of you all, and if there is anything that any way that you would like to contact us, feel free to post on our Facebook or Insta or Twitter, wherever. This is Kayannush Dadachanji from Sparkle Dental Care, Bombay. Bye. Have a great weekend.